know what healthy living is all about? Do you want to know how can you live happier and longer? How about learning about balance, spirituality, and prevention? To know how you can live in harmony with others and how to add balance to your life? Know more about prevention and many, many more of the health topics?
Make sure to listen to Healthy Living. Healthy Living, prepared and presented by Fida Amin.
Good afternoon, everybody, and welcome to Healthy Living, our weekly meeting to discuss and talk all about how we can live healthier and happier, how to make the right and healthy choice for all our daily life aspects, and to learn more tips on how to maintain this new way of thinking and new way of living. Today's topic is about obesity. Obesity is a growing problem globally and locally as well. Today, in this episode of Healthy Living, we will know more about obesity here in Jordan and how can it impact our physical and psychological health. So what is obesity? How can we define it? Well, obesity is a complex disorder involving an excessive amount of body fat. Obesity is a chronic disease that increases your risk of many diseases and health problems, such as heart disease, diabetes, and high blood pressure. Being extremely obese or overweight means you are especially likely to have health problems related to your weight. Now, before we proceed with more about obesity, and as usual, let's listen to a report that was previously recorded and prepared by Lima Al-Rosan here at the JU campus, asking some students about obesity.
Hello.
Hello,
What's your name?
Abdullah Shemali,
What's your major?
electrical engineering.
Do you think obesity is a problem here in Jordan?
Maybe now it's becoming more of a problem. You can see it now very much, but I think it's really getting a problem nowadays, and to the future I think it's going to be a problem.
Do you think it's more of the elderly or the youth?
Youth, I think it's, yes, the youth, because youth nowadays are they don't eat much at home, so they don't eat a lot of healthy food nowadays, especially that a lot of junk food restaurants are now opening. They're now easier to go to, and they actually, when youth likes to hang out more, go to the mall, they eat all fast food and junk food and stuff like that.
Do you think our lifestyle does contribute to the problem?
Yes, if you like to go out a lot, that means that you don't stay at home and eat healthy food. You go out and seek other restaurants like maybe McDonald's or maybe Burger King, and they are all not very healthy foods.
How can obesity hurt our bodies?
Maybe in different ways. It could result in diabetes. It could result in back pain. You can't do sports, so your body will be maybe you can't see it right away, but in the late years, after many years, you don't have very much muscles. It will be fat and it will be thick.
Okay, thank you, Abdullah.
Thank you.
Hello.
Hi,
What's your name?
Dr. Bilal Garaibi.
Do you think obesity is a problem here in Jordan?
I actually do believe, I've seen, it's very obvious whenever you walk, and you can see this, it might be an issue in this country.
Do you think it's more spread in the elderly or the youth?
I think it's more into the elderly people. Actually, most of the youth people are now more active in the gym and do exercise. However, probably the food habits or the eating habits are not very well organized. But I still see it within the elderly people, yes.
Do you think our lifestyle does contribute to the problem?
Most definitely. Is it the lack of exercise or the work stress we have, and also that you get to eat some of the fast food during work hours. And after work hours, I think most people do like to have regular meals at their homes. but still during the work days and between the meals you definitely will eat some chocolate or some fatty food as well.
How can obesity hurt our bodies?
Obesity it's definitely known that it affects your heart's blood pressure and maybe your back, especially if you have a desk job or you work in a governmental office or any office. So it is related to a lot of the health issues, yes.
Thank you, doctor, for your time.
You're most welcome, thanks.
Hello, what's your name?
My name is Tariq.
Tariq, do you think obesity is a problem here in Jordan?
Yeah, it's kind of a problem here for all people older than 30, but teenagers and adults until 30 they are okay.
Do you think our lifestyle does contribute to the problem?
Yeah, of course. Eating and sleeping is a major problem. Like we eat the dinner, we eat at night and sleep. We eat mansaf and sleep always.
Yes, so mansaf is the problem.
Kind of.
How can obesity hurt our bodies?
It reflects to the health problems, diseases, pressure, the back pains and diabetes, the knee pains.
Thank you, Tariq.
Back to you, my listeners. As we heard, obesity is considered a problem that need to be well addressed. We need to know more about how to stop this increasing danger that can impact our health in a negative way, a way that can hurt us and can hurt our future generation as well. Coming up next, an interview that was conducted with Dr. Mahmoud Abu Khalaf, the professor of surgery and senior consultant in surgery at the Jordan University Hospital. Good morning, doctor, and thank you for having us today. We're glad to have you with us. Doctor, before we proceed with the interview, we would like to know more about you and your job here at the JU Hospital.
I am a senior consultant in surgery of the GI tract at the University of Jordan, Faculty of Medicine, and the University Hospital.
Doctor, as a professor of surgery and senior consultant in surgery at the Jordan University Hospital, what are your views on obesity in Jordan?
In general, in the whole world, obesity is increasing and has been increasing a lot after the 50s, including the Middle East and including Jordan. We see a lot of obesity in Jordan, and that's creating a problem. It's also a great problem in the Arab world in general.
And doctor, so you do believe that obesity is an important issue today and a growing problem in Jordan. Do you agree with that it's a growing?
It is increasing at a very fast rate, alarming rate, especially in children. And because of that, we expect the rate of obesity in the general population to increase over the next few years.
What are the reasons for this increase?
The leading cause of obesity is thought to be the change in the life, in the way we live, and also the genes which we have. The way we live has changed tremendously, especially in the last 60, 70 years. We became a little bit lazy. We don't work physically, and we travel comfortably, and we watch the news in a relaxing way, and we eat a lot. That's why we think obesity is becoming more. The other thing which is extremely important, food is available. We don't have feminine as we used to do, and our genes has become adapted to the new life which we have.
Doctor, what are the bad effects of obesity, physically and psychologically, if there is any?
This has been studied extensively, and there is a group of diseases which are known to be increasing tremendously in obese people. We call it the comorbidities of obesity, and that affects almost any part of our body. The other thing the obese people have problems. They have problems in adapting to life. They have problems in, for example, in transportation. They have problems in the schools. Performance of school children who are morbidly obese are not like the normal weight children. There is a great problem in discrimination against the obese people. If an obese person competes for a job, it is very unlikely that he will get that job. People discriminate against them.
Bullying as well, maybe.
Well, and it is not the traditional bullying, but it is calling names, giving nicknames for obese people, teasing the obese people, especially in children.
So it can affect us psychologically.
Sure it can, and it almost affect everything we do in life.
Dr. Mahmoud, do you see obesity in Jordan getting worse or better within the next years to come? Are we doing something about it, in another word?
No, it is not going to improve. It is going to get worse. The simple thing, we are not paying a lot of attention to obesity. We are not using promotion for a good health, and we don't have a lot of facilities for us to live and to exercise in a healthy way. Also, we are not changing the way we live, so we expect it to get worse and not to get better until we do something about it.
So, doctor, you think it's a mentality set as well? Like, this is the way we think. We're accepting the fact that we are obese and it's okay to be overweight?
No, it is not. We see the obese people, they don't like it. They do what they can to get help to lose weight. They are not getting the help in a good way. For example, if you are rich and you can go into a spa and follow diet and so on, you have a chance. If you are poor, you don't.
I see that going to the gym or a spa, people use that as a pleasure, not for, like many people go to the gym for like have fun and spend time, like as a privilege, but they really don't do it for health reasons.
Their intention is to use the spa, to use the dieting to lose weight. But do they get the proper advice? Is the spa a supervised place which provides the help which they need? That's questionable.
Dr. Mahmoud, do you think implementing fitness and nutrition lessons in schools, starting in elementary, would be a positive step in preventing obesity? I mean, at least in the future generation.
It has to be part of a general program. Create awareness. Why people get obese? What can they do to avoid being obese? And if they are unlucky and becomes obese, what to do about it? Now, certainly, the educational programs about obesity has to start at home. The mother herself, how to feed her baby, how to watch her weight during pregnancy, what to do with the children before they go to school. And of course, the school has to have education programs about healthy diet, about exercise, about avoiding the food which is not good, the junk food.
The problem, doctor, they sell junk food in schools and universities. They sell junk food. We don't have like healthy snacks. They're not even available, that much.
Well, that's wrong. And I think the cafeteria for the school or the universities should be supervised and should support healthy food. The main function of the school is to create awareness about proper weight control for the children as they in school, which will prepare them for later life. Same thing with the university education. In the university education, you should have part of the general programs which we teach the children is a program about a good health and how to manage to avoid the problem of obesity during the phases of our life.
Dr. Mahmoud Abu Khalaf, here from your location as a professor surgery and senior consultant in the surgery at the Jordan University Hospital, what advice you give today for youth about their weight struggle?
The youth, they should understand that Nowadays, there is measures to keep watch on the weight, and these measures entitles getting on the scale, weighing yourself, having your height, calculating your what we call the body mass index, and trying to keep in range which is acceptable. Okay, and if your weight starts going up, is to try to do things to go down with it. Now, the things which go down with the weight is to keep active, exercising, and to eat a healthy food. The healthy food, by definition, is a food which has the proper nutrient materials which we need to avoid high calories, to avoid fat. The Mediterranean food, which is available in this region, has proven to be the best food to keep your weight. Okay. Unfortunately, the youth, most of the food which they taste is a fast food which is rich in calories and very harmful to the person. So they have to learn how to eat, and they have to get involved in activities.
Thank you, Doctor, for being with us and sharing all this useful information. Thank you so much.
At the end, thank you for the Healthy Living program. It is an excellent program. And also many thanks to the JU radio station for this useful program.
Back to you, my listeners, and more on obesity. Now let's point out some facts about what the doctor said. So, what causes obesity? Scientifically speaking, if you consume more calories than you burn as energy through physical activity, then you'll gain weight. But it's actually not that simple. Many factors contribute to obesity. Those factors can be a complex combination of genetics, socioeconomic factors, metabolic factors, and lifestyle choices, and other things such as some endocrine disorders, diseases, and medications can also cause weight to increase. Now, I really want to talk about also the bad impact of obesity in our health, which can hopefully change the way we think, the way we eat, and the way we live, which is the secret for better health, is accepting to change our lifestyle into a healthier one. So what are the risks we are taking when not paying attention to what we eat and gain excessive weight? The first problem obese people will be in risk is having coronary disease. Now, coronary heart disease is a condition in which a waxy substance called a plaque builds up inside the coronary arteries. These arteries supplies your heart with oxygen, and plaque can narrow or block the coronary arteries and reduce blood flow to the heart muscles. This can cause a heart attack. Obesity also can actually get more serious and lead to heart failure. High blood pressure is another problem, and your chances of having high blood pressure are greater if you are overweight or obese. Obese people can be in high risk for type 2 diabetes as well. Diabetes is a disease in which the body's blood glucose or sugar levels is so high. In type 2 diabetes, the body's cells don't use insulin properly. At first, the body reacts by making more and more insulin to control the blood sugar. But unfortunately, with time, the body can't make enough insulin to control its blood sugar level. Having diabetes is a big problem because it is the leading cause of early death. It can also lead to stroke, kidney disease, and blindness. Most people who have type 2 diabetes are overweight. Obese people can also have abnormal blood fats. Abnormal levels of blood fat include high levels of triglycerides and bad cholesterol and low levels of the good cholesterol. Abnormal levels of these blood fats are a risky factor for coronary heart disease. Being overweight or obese can also raises your risk for colon, breast, endometrial, and gallbladder cancers. It can also cause osteoarthritis, which is a common joint problem for the knees, hips, and lower back. Another disease that can be also included in this list of diseases that you may have if you are overweight is a sleep apnea. Sleep apnea is another common disorder obese people can suffer from, which is when you have one or more pauses in breathing or shallow breaths while you're asleep. Obesity can also hurt our children and teens, and an increasing number of children nowadays are developing this disease. Also, overweight children are more likely to become overweight or obese as adults, with the same, of course, disease risks. So what shall we do to protect our bodies and our kids' bodies from carrying so much weight and have healthier ones? We need to create a weight loss plan, a plan that is especially designed for you, using the help of an expert, a doctor, or a nutritionist. For an example, you can try to slowly lose weight. 1 to 2 kilos per week, for an example, or losing at the rate of a half a kilo per week. Even at that lower rate, over the course of a year, you'll lose 10 to 12 kilos. And if you maintain that rate, over 3 years, you'll drop 35 to 38 kilos. Now, regardless of what treatment plan you follow, losing weight slowly will be more effective and healthier over the long term because quick weight loss often causes weight regain, and we don't want to regain the weight we spend so much time losing. We can also fight obesity using prevention. Preventing obesity can happen in many ways by improving your eating habits, and increasing physical activity play a vital role in preventing obesity. You also want to keep the weight off. Maintaining the proper weight you have or you worked hard to reach can be very challenging. But sticking to all the healthy living tips we've talked about previously, such as eating well, exercising, and changing your lifestyle into a healthier one, will definitely help you maintain the proper healthy weight you reach. So it's a mentality set and a way of living. All right, everybody, time is passing by, and before I say goodbye, I want to say this. Get healthy, get moving, and make sure to get a life. Thank you for listening, and stay tuned for more of Healthy Living. Until next time, have a wonderful, sunny, springy, and healthy day. Bye-bye. Do you know what healthy living is all about? Do you want to know how can you live happier and longer? How about learning about balance, spirituality, and prevention? To know how you can live in harmony with others and how to add balance to your life? Know more about prevention and many, many more of the health topics?
Make sure to listen to Healthy Living. Healthy Living, prepared and presented by Fida Amin.